The rotator cuff is a group of four muscles that surrounds the ball and socket portion of the shoulder joint, and the job of the rotator cuff is to compress the ball into the socket, allowing us to reach overhead and perform overhead activities. There's four muscles of the rotator cuff, one in the front, two up top, and then one in the back, and they all work together to allow the arm to move properly. Rotator cuff problems can have varying levels of severity. First beginning with what we call tendonitis or irritation of the rotator cuff. Over time, the rotator cuff can thin out and start to develop either partial or full thickness tears, which may need to be managed surgically. Or you can have an acute injury to the rotator cuff where you're lifting something heavy overhead, or maybe have a fall and have a big tear of the rotator cuff, which may need to be treated. For irritation of the rotator cuff, or what we call rotator cuff tendonitis, typically the first treatment is beginning physical therapy to work on range of motion and strengthening of the muscles of the rotator cuff. This can be in conjunction with various types of injections, which can help decrease inflammation in the rotator cuff and aid with rehab. In some situations, when there's a large tear of the rotator cuff where the actual muscle of the rotator cuff rips off the ball portion of the ball and socket, we can do an arthroscopic procedure, which is minimally invasive through a series of portals surrounding the shoulder. And this allows us to go inside of the shoulder joint and repair the torn rotator cuff back to the bone of the ball and socket. Other issues found within the shoulder, such as tears of the biceps, bone spurs, and arthritis of the clavicle, can be taken care of at the same time as a rotator cuff repair. If you're having an issue with either the shoulder, knee, or the hip, I'm happy to see you in the Kona, Spartanburg, or Duncan locations. We'll get some imaging studies and get your affected body part checked out and figure out exactly what's going on.